roll. Commissioner Sturm?
You're muted.
Yeah, you're muted. You're here. Commissioner Hart? Commissioner King?
Here.
Cool. Commissioner Gardner? Vice Chair Bruder?
Present.
And Chair DeJong is here. Cool. All right. And the next order.
Hi, everyone. We're giving folks just a few more minutes to log on and
Okay.
get situated. So we will probably get started in a couple of minutes, maybe 5 minutes.
Okay, we can do that.
Okay.
Do we have to have a quorum for this commission?
Yeah, last time it was four. I believe 4 of us needed to be here.
That's it? 4
Yeah.
out of whatever it is, 16 or 20 or however many we have.
Yeah, there's only actually, I think 7, as many board supervisors as there are, then those are the actual commission, whoever was appointed by them. I believe that's
And
the entire board.
Yeah, there's
Yeah.
one for each supervisor and then 2 at large. So a total of 7.
We're going to get
So-
That's what we should have.
before starting.
Okay, I'm gonna wait like 1 more minute, you guys, and then I'm hitting it.
Okay.
Well, Tibby sends her apologies for not being able to make it. She had her father pass away, so she had to deal with that going on. So she told me to say hi, and that she's sorry she can't be here, but to carry on.
Understandable, my goodness. Yeah. Did everyone get a chance to read the minutes? Okay. Does somebody want to move to approve them?
I move to approve the minutes.
I'll second that.
All in favor?
Aye.
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 Great. All right. Now we are on number 3, program updates.
So just a few points on updates. We've brought in a couple more peer mentors from the medication assisted treatment program who are now staffing the exchange a couple times a week here at Emmeline, trying to bring in as many persons with lived experience as possible. But of course, it's always a balance to make sure that that person is comfortable in an appropriate place in the recovery to work in the exchange. So I work with Danny, the manager of the MAT program, to target persons who are ready and would benefit both the exchange and gain some benefit themselves to work. So 2 more, and they are starting this week, or I should say this month. So that's a great thing. We also have been able to bring a nurse back to staff the exchange on Wednesdays and Thursdays. So just as her responsibilities due to the COVID response wound down at least a little bit. She's able to dedicate some hours to the exchange. And then we have MAT counselors on a rotation every Monday now in the Emmeline Exchange. The Watsonville Exchange continues to be staffed by the MAT team, by counselors, and there's a medical assistant who also staffs that exchange during their hours. We have begun to distribute MAT provider contact information during each encounter. So as far as the education offered during an exchange, in the past, there was a little bit of nuance and our percentage was not very high. And that was in part because we were going off of significant conversations and we were marking that as education offered or provided. That did not capture the actual education being offered and given during each encounter, which if someone got a flyer or if there was just a quick exchange of information, we weren't necessarily marking that as education offered. And we were targeting more of the encounters where there was a significant exchange of information that led us to believe that that might lead to a referral, or the person might actually make a contact based on our exchange, or an actual referral. We would mark that as well, which reflected that we weren't actually having that many encounters. And so to try to, one, show that we were actually giving information on drug treatment, and then two, to actually try to be proactive in getting that information out there and giving education, even when it wasn't a conversation that was broached. So what I did was I put some signage up saying that during each exchange with the supply bag, we are handing out contact information for MAT providers, as well as the medications that they're using to provide care. And contacted several of our county MAT providers just to let them know of my intention and to give them a peek at the quarter sheet in case they had any input or objection. And I didn't get any objections, so we've begun to do that. That should show that our numbers in education have gone up significantly in future reports. But again, that's not really changing our encounters that much. It's really just making sure that the information is provided and is going out in supplies and hopefully getting out into the community. So if someone's not ready to have that conversation when they're in the exchange, they at least have the information on them, and it can get to people that aren't showing up to the exchange. That's that. And then also, we now have another kiosk up and running off of Felker Street. I believe during the last meeting, the one at San Lorenzo Park was already deployed. So now we have another deployed and being serviced off of Felker Street. And as far as updates, that's where we're at.
Great. Thank you, Rashawn. That is really good to hear. That, the MAT information is getting out to them. With that, that makes me happy. Anybody have any comments or questions?
I just have a quick question. Do we know what the entry into detox is right now. So I guess what I'm thinking is, suppose you have what turns out to be a successful education experience with someone, and they say, okay, I'm with you, I'm ready right now. Can you get them into detox right now?
So those numbers change, as far as availability. So getting someone into contact with the actual provider is the best way to approach it at this point. So, on any given day, no, I do not have the numbers available to see if someone can actually get in that day. I am setting up, in the process of setting up monthly meetings with Janice, so that we can have discussions as far as what their program is looking like during the month, so that I can have some updated information to give to our participants. But there is quite a bit of fluctuation as far as services provided on any given day. So no, I do not have that information at the moment. I don't.
Okay.
What I happen to know is that
apologies. I'm just going to add to. I find that the best approach is to try to put the person in direct contact with the provider.
Mm-hmm.
So if they're open for that in the moment, then sure, we can make the call, and we do attempt to do that, leading with our county MAT team. But as I said, information does change, and one thing that I really try to avoid is giving false information to people, because that can lead to a mistrust of the staff. So better to just refer to a provider rather than give information that is outdated.
Great. Thank you. Anything else?
No.
Commissioner King? Okay, thank you. Vice Chair Bruder?
Hey, good evening, Mr. Williams. How are you?
I'm doing well, thank you.
Awesome, good. I appreciate the report. I'm glad there's more education material being put out, even when people aren't asking for it. It's more of an opportunity for people to see. They might be sitting wherever they're sitting and look through their bag and go, and read that and think about it, and it plants a seed. So I think that's a really great thing. One of the questions that I have concerning the program is, have you restarted doing Hep C or HIV testing?
We have not. We have not restarted that.
Do we have any kind of timeline? Is that are you seeing it in the distant future, or is it just sort of not even in the mirror right now? Not.
Well, I would say it is a topic of discussion, and perhaps Jen might have something to say on that. It is. It's a constant thing that is on our minds, but it's really just a balance as far as what our program at the moment is able to provide. But I'll defer to Jen some on that.
Thank you.
Yes, so can you hear me okay?
Yes.
Thank you. Thanks. So I'm, for those of you who don't know me, I'm Jen Herrera. I'm the Chief of Public Health, and SSP. SSP is one of our programs in the Public Health Division of HSA. So yes, just to validate what Rashawn is saying, it is something that we think about often and are actually setting up the infrastructure to continue soon. We don't have a specific date of when. Apologies, there's an echo. Thank you. We don't have a specific date of when we're going to restart, but what we do know, which was announced by the governor this afternoon, is that the state is expecting to lift the shelter-in-place order, the statewide shelter-in-place order, by mid-June. that's dependent on having a good vaccination uptake. By that time, we're hoping to have around 70% of California's eligible population for vaccines vaccinated. And at that point, without a shelter-in-place order, that means that we're not going to have the capacity restrictions that we see with the current situation for the pandemic response. There will still probably be some guidance on, trying to maintain some physical distancing and wearing face coverings and masks. But assuming that we have a good amount of folks vaccinated, the risk for transmission significantly decreases. So how that relates back to Hep C and HIV testing is, that's a time frame for us to really consider having a shift to reinstate those services. Because HIV and Hep C testing, there's a swabbing component and or the finger prick component. So there's body fluids involved, but it's also the counseling portion. So it's the 15 to 20 minutes of face-to-face contact with a person in an enclosed room talking about risk reduction strategies. So it's, assuming that our staff, I think for the most part are vaccinated. A lot of the unhoused population are being vaccinated right now. But once that vaccine rate increases in the community, we're likely HSA in general, we're looking at how to restart in-person services. So that was a long-winded answer, but just to provide context, the reason why we stopped doing these services is because of the pandemic. And now that we're seeing the pandemic isn't going to be over, but with the state shifting away from these capacity restrictions, we're probably going to see an increase in in-person services soon.
Thank you. That ties right in with the next question that I have. Is the SSP being utilized as a contact point, conduit, or administration point for the COVID-19 vaccines? Rumor has it that there are private harm reduction coalition programs out there that are vaccinating people, which I don't have a problem with. I'm just wondering if they can. Why aren't we? I mean, it seems like a great opportunity since you have people walking in the door.
So, Rashawn, I can take that question as well, since I'm pretty integrated in the vaccine response. We do not have vaccinations happening through our SSP program. Both per board directive, our SSP programs are co-located by a health center. So in Santa Cruz, it's at the Emmeline campus. In Watsonville, it's the Watsonville campus over on Freedom Boulevard. So if there's a need for vaccination, we do link people to those centers for vaccines or to HPHP, Homeless Persons Health Project. So when it comes to unhoused individuals, there's our Homeless Persons Health Project, which is under the clinics division, has been doing outreach to do vaccines out in the field, and they've been collaborating with community partners to do that. And they're able to do that with their, with their infrastructure as a health center. So, they have nurses, they have, the staff on site to do the vaccine monitoring. They have the infrastructure for that. I think once so if there is vaccines happening with the Harm Reduction Coalition or some other organization, it might be a partnership, but we're not giving vaccines directly to non-healthcare organizations. Vaccines are still in scarce supply here in Santa Cruz County, so everything that we're doing is really targeted towards the focused populations that the state has directed us to allocate our vaccine to. And until we start to see more, really more of the Janssen vaccine, which is a single dose option, which we barely are getting any right now because supply is still ramping up. But once we get more of that, then we can start looking at having some regular clinics co-located at SSP. And then the other consideration is just space. Both of our locations in Watsonville and in Santa Cruz are pretty small. And so just thinking about we can certainly include vaccinations as part of a service that's provided, but it's a pretty small setting already with a lot of things going on that we're trying to limit the number of people and movement in those settings.
Thank you very much. That does clarify some things. And I in no way meant to imply that that vaccines were getting allocated to outside sources or anything like that. I do believe that whatever the HRC might be doing is probably in partnership with the HPHP. I'm sure they're not out there just vigilante vaccinating. I just want to make that clear. But thank you very much.
That's a new one, vigilante vaccinating. All right, anybody else have questions? All right, so we're gonna, number 4 is review mandates or directives. And the little underneath there is direct HSA to return in June 2020 with recommendations to improve syringe litter reporting and response through a centralized system.
So Chair DeJong, I can take that. So we wanted to bring this to the Advisory Commission's attention that we were asked to come back to the board with this specific directive. I'm just going to repeat it. It's direct HSA to return in June 2020 with recommendations to improve syringe litter reporting and response through a centralized system. So this recommendation came from, we did a syringe access and disposal survey back in December of 2019. And at that time, it was clear that we were getting a lot of reports that there's a lot of syringe litter in the community. And the issue that we found is that it's not that we were disputing those reports. It's just that they were coming through in different packages. It was either an anecdote, like someone just writing up a story and telling us what happened. The city of Santa Cruz has a really great database, so that was a little bit more formal through their reporting process. And so we thought, this is of concern to Santa Cruz County residents. So we thought it may benefit the community to have some sort of centralized system of reporting syringe litter. So prior to the pandemic, the idea was that we were going to take time as a program to talk with partners and figure out what would be a good system. An idea was to use the Citizen Connect app, which is through the county. I believe there's going to be a presentation on it now. It's now called My Santa Cruz Platform. But when it comes to syringe litter, this is a program this is a service that goes beyond the jurisdiction, the legal jurisdiction of what public health as a division is typically responsible for. This is something that, we have a public works department, not just in the county, but in the city jurisdictions. We have our parks and recreation, which I believe Commissioner Sturm, you were part of Parks and Recreation, so they play a big role in cleanup efforts throughout the county. So there's all these other partners who there's actual legal jurisdiction when it comes to this type of cleanup and understanding sort of the rules and regulation that we need to reach out to hear what their thoughts would be around a reporting app, because there's a reporting piece so that we kind of have a good sense of what's going on countywide in a way that's collected in a consistent fashion. And then there's the what comes next, how does it get picked up question, which is not as simple as just call a line and someone will go out and pick it up, because it does have to depend. It depends on jurisdiction. Is it city land? Is it county land? Is it private land? And then who is responsible for it then? And it's, I would say, based on my conversations with folks on this topic, it's, people want to see a healthy and clean community. But it is, we are kind of stuck in these jurisdictional bubbles that we're kind of working through. And that is not, I wouldn't even say that's necessarily a downfall. It's just something for us to recognize and work through. So come May 25th, we're going to have some sort of recommendations, and we're still working through what that's going to be. But part of it is going to be informed by conversations with the various public works divisions throughout the county. And I know previously we had reached out to CBOs and community organizations who collected syringes. I believe Chair DeJong, you were part of that meeting, and that was super informative. That actually really helped inform where we did our visual inspections and how we did it for our syringe access report. So, I think we will, we want to reach out to partners, but I wanted to bring it up to this advisory commission to see if you had feedback on how we approach this. And of course, we'll have this presentation from My Santa Cruz platform as well to kind of inform if this is a strategy that, to get your feedback on this strategy.
Great, thank you. Thank you. Does anybody have any questions or feedback?
I do. Just from the perspective of a citizen, what you just described is the ultimate goat rope, where one part of the county is literally providing everything it takes to create the litter problem.
Mm-hmm.
I mean, and I mean that with all due respect and the consideration that I have for the need and all of that. One part of the county is like feeding this problem with some expectation that other parts of the city or the county are going to clean up after the problem. And I'm just commenting as a citizen about how backwards that seems to me.
Anything else, Commissioner King?
Nope.
Well,
Actually, I'm sorry, I do. So is the idea that when we're having these conversations that we should be also including somebody from Public Works or from Parks Department to participate in the decision, in the decisions that we're making in this group? Do you know what I'm asking you? Like, do we get feedback from them, and do we need feedback from them when we're making decisions about how syringe exchange should work?
I have something I'd like to say. So as you know, I spent a number of Saturdays cleaning up syringe litter from different places: San Lorenzo River, Carbonell Creek, Harvey West, Poganip, and I agree with Commissioner King in that it seems like, it's, these syringes are being, put out there by the Syringe Services Program. And anyone, you guys may not know my history, but I'm a recovering addict. I've been clean almost 30 years. And like, when I'm loaded, I don't think about something to put that in, like I'm passing out or I'm doing whatever. So I don't know that we can constantly think that the person active in their addiction is going to be responsible for taking care of that. And I think sometimes the community forgets that. But I do see a lot of, how do I say this? I do see a lot of, well, we can't handle that. That's not our job. And then it gets kicked to the city, and then it gets kicked to the county, and then it gets kicked to Public Works, and then the Rangers. And I understand all the legal aspects of that. I really do. But I just wonder if maybe, like Commissioner King said, that we bring others in here and have I feel like we need more people at the table to come to a solution, because it's what we are as this commission right here. But then we're saying that it's someone else's responsibility. So we need to, I would like to hear it from them when we say that this is Public Works issue. I would like to hear from them that, okay, yes, we'll do this. You know what I'm saying? it just seems like, the amount of syringe litter, and I haven't touched it. I haven't done it in years, because I got burnt out. But I've seen a lot on Facebook with stewards of the levy, Vice Chair Bruder. He's picking them up all the time. So, and one of the things I had heard back when I was doing it was that these syringes posed no threat to the public. Yet when it gets to Emmeline campus, suddenly there's this we can't look inside the syringe containers because that violates OSHA. So, there's just been a few things on my mind in regards to the litter itself. And those are the main ones. So thank you, Commissioner Sturm, and then Vice Chair Bruder.
I'm new to this commission, and I'm still learning my way through it. I'm listening a lot instead of talking, but that's okay. One thing that I'm having trouble with, and somebody here can help me, is what is the charge of this commission and how far out do we go? And then with that, what authority do we have? For instance, let's look at reducing needles. Well, then it strikes me, let's look at reducing use. If you reduce use, the needles parallel and go down as well. And then, if we're going to reduce use of injected drugs, how do we get out in front of that to have a consequence of less needles showing up? And then your point about when you get the high, you're not thinking about what to do with the needle, right? And so it's very hard to educate or in that moment have a response that's positive for the safety of the needle and others. So I guess my question is, what is the scope of what this commission is trying to do? What are we trying to do, and how big a net are we casting to try and get something done with safety around syringes?
Chair DeJong, can I go ahead and chime in?
Sure, of course.
Yes, I'm just actually looking at the powers and duties of this advisory commission, and I'm just going to read the first two lines, that the Syringe Services Program Advisory Commission shall exercise the following responsibilities. It lists A through E, and A is help increase coordination between agencies, departments, jurisdictions, and other stakeholders related to the delivery of services provided by Syringe Services Program. So to your question, Chair DeJong, on, can we include other partners to this meeting? Absolutely. And I'm actually, I can reach out to Public Works next week to see if they can come to this next meeting and, talk about their efforts around syringe cleanup. If it's helpful, I can read out the other ones, the other powers and duties as well. So
that would
A
be
was.
helpful. I was going to say, my apologies. Would it save time to put it in the chat or attach it somewhere where I can read it after the meeting?
Yes, actually, Crystal is our admin aide for public health who's helping with the logistics of this meeting. Crystal, could you send out the ordinance to the commission after this meeting, please?
Yes, I can definitely do that.
Great. Thank you. And the other items, just in summary, it's reviewing policies related to the delivery of the program, review any pending state and federal legislation relating to SSP services, staying informed and educated on syringe services and public health strategies, and providing a forum for consumers and other parties interested in syringe services to contribute ideas to policy and program development. And then I would say, as a commission, you have direct access to our elected officials to be able to, advocate as a commission on recommendations for the program and for services countywide.
Great. Thank you, Jen. Vice Chair Bruder.
Hi. So this goes back to what Commissioner King stated, how it's just so convoluted to try and get something done. You know, it all originates in one spot, but it takes 72 different other spots to make it come full circle. And along that line, so if the county is providing the syringes and all the supplies that go along with that, a myriad of other things, and it's all ending up in the ocean, on the riverbanks, in the gullies, in the fields, and in the parks as environmental hazards, let alone some of them biohazards. Where is the county's legal responsibility to mitigate the impact on the environment, let alone with the biohazardous part of it?
So as a public health department, we have a responsibility to assess the impact of like conditions that affect health, you know, such as like environmental conditions that affect health, and, you know, provide policy recommendations around that. And it is a core component of our program. You know, when we talk about Syringe Services Program, it's a three-pronged approach. It's distribution, collection, as well as the enhanced referral. So those three things all go together when we're talking about syringe services. It's not just distribution. So the way that we've dealt with the collection piece is through the distribution process by collecting syringes. It's also by contracting with CBO partners and cleanup agencies like Clean Team Associates. And we have this, the litter abatement program through Downtown Streets teams. You know, so those are the types of strategies that we want to continue with pending funding. I'll say that syringes are, there are more syringes collected than we are distributing right now. And, you know, there are other avenues to get syringes, and we're not saying that we don't have a part to play in helping to support syringe cleanup and assessing the problem and helping to convene partners. But there's infrastructure in the community beyond just a public health department that actually has resources to help address this issue. And that they're doing their job. You know, Parks and Rec is doing cleanup. We have CBOs who do cleanup, and we have Public Works who do cleanup. And, you know, by all means, I'm not saying that that's not a value judgment of whether that's enough or, you know, anything to that effect. It's, but just knowing, actually just echoing what Chair DeJong was saying, is that there are other partners who have a stake in this beyond just public health. You know, when we see plastic bottles out in the oceans as well, you know, are we asking all convenience stores to chip in and support, you know, cleanup efforts? I mean, it'd be great if they do, and maybe they do every once in a while, but it's not a mandate. That's in legislation. I mean, we all have a part to play in terms of cleanup. So I guess I'll say there, you know, I think we recognize that we're part of the solution and that we are also a partner who's distributing syringes. And we, as a public health agency, we also play a part in helping to convene agencies around this health issue to see how we collectively can come up with a solution.
Okay. All right. Anybody else? Oh, Mr. Vice Chair Bruder.
Thank you. That conveniently led into another question that I had written on one of the little yellow Post-it notes. The last meeting, we talked about a contract that the county has with the Downtown Streets team to collect needles. I'm extremely curious what the cost of that contract is per month or per year, and what kind of dollar value we're getting for that contract.
So I'm not sure if you want to speak to that or let me add it, Jen.
Sure. Yeah, you can start, Rashawn. I'm happy to fill in.
Okay. So our contract is roughly $1,000 a year, and they're addressing designated hotspots. They do have some flexibility, to react to specific complaints, but their main spots are hotspots that were designated through that syringe litter study. As far as what we are getting for that money, that's I think a little bit more of a difficult question to answer, and I think that leads to the issue with syringe litter, just generally speaking. So, for instance, we have for January, 214 syringes were collected by that team, and in February, a little over 500 was collected. Now, syringe litter can be, up in the Pogonip. If you're taking a walk and you happen upon, an encampment, a site where syringes are left, and it's going to be difficult to have the person power to react in the moment every time a syringe is found, because by nature, they're not necessarily all going to be collected in the same location. Oh, there's 100 of them right there, right? So it's just a very difficult problem to solve. And speaking from a public health, perspective, we're dealing with. It's hard to solve the two problems at once. I'm going to talk a little later on one-to-one versus as-need syringe exchange. And the one-to-one is in part to try to address the problem. We have kiosks that we're putting up. But as Chair DeYoung pointed out, if someone is in the moment and high, they're not necessarily making the smartest decisions about, how to dispose. But we do have that information. We're pumping that information out from the exchange to hopefully affect as many people as possible to make smarter decisions and to make the responsible decision. But to get back, as far as person power that we're able to, finance as far as teams are concerned, it's in the big picture, a syringe on the ground when you're on a hike is a big neon light. It's disturbing. I understand that completely. But just by nature, it's a little difficult to have, as big as the county is and as many nooks and crannies, someone reacting in the moment all the time to clean up syringe litter wherever it's found. And the solutions that we've come up to the point is, okay, more kiosks upon, agreements with different municipalities, and trying to figure out where the hot spots are so that we can deploy our resources and make as big an impact as possible.
And I'd like to add to Rashawn's summary related to Downtown Streets team. It's syringe litter cleanup, but it's also a work skills program. And the reason why we were really interested in partnering with them is because of the funding that we received recently, California Harm Reduction Initiative, or CHEERI grant. Part of it was providing resources and support for people with lived experience, either current or very recent experience of using drugs, to be able to help inform our syringe services programming. And so it seems like a really easy partnership. We love working with Downtown Streets team and having the work study partnership. They serve the Santa Cruz region, I think countywide as well. That's kind of the focus. So there's syringe cleanup, and then there's also the peer involvement into our programming.
Thank you. So I crunched some numbers that Mr. Williams gave me, $78,000 a year to the downtown streets team. And I know that's an approximate number. If we think about it, I always see them travel in teams of 3 or more. So 3 people getting paid $20 each per day, 365 days a year is $21,900. That leaves $56,100 out of that $78,000. What are we getting for that? I understand that Ms. Herrera just explained there is a work training partnership type program that goes along with that, or hopefully goes along with that. But we're paying more than twice as much for that than we are for the service of having things cleaned up. I do understand that we can't have people running willy-nilly, hopping on bicycles and jet skis and whatnot, running out to pick up a syringe here and then one over here 4 miles away. I know that that's really tough. I know it is. I'm just wondering if we can get better value for our dollars somehow with that contract. Not saying we don't need the contract, and I love the downtown streets team. They do great. I see them all over. They do awesome work. But we're spending a lot of money. I mean, to me it seems drastically unbalanced for what we're getting.
I think I'll also add to that that is the limit, the ceiling to the agreement. I think throughout this year, because of the pandemic, it was just a slower start, so they didn't get to have their teams up and running as quickly as we had all hoped, and they weren't able to go out as frequently. So the reality is that the actual dollar amount will come in below that $70,000 mark, but that was just the ceiling based on I think the expected service, and Rashawn, correct me if I'm wrong, it was like 5 days of cleanup, and I forgot the number of folks on the crew.
Correct. Yeah, it's 5 days, and there are 5 crew members, and the exact number is 78,520. But again, as Jen mentioned, there was some difficulty in actually getting the work crews together at some point and getting traction, and of course, not to put everything on it, but COVID was a huge factor in that, right?
And Commissioner Bruder, I think to your question of can we, find something of better value for, like fiscally, absolutely, that's something that we'll be taking a look at.
Thank you.
All right. Any other comments or questions on that item? No? Okay, thank you, you guys. Moving on. Item 5, syringe litter reporting, which is kind of what we just talked about. But
thank you. I assume this is my part, right? All right.
Sure.
So I'm going to do a demo. I'm going to take over the screen and share my screen. I'm going to be using the online version, the Santa Cruz County, my Santa Cruz County phone app, but I have a desktop app that everyone has access to as well. I'm going to simulate the phone app because when you do demonstrations on a phone, really, you have a lot more issues. So I'm going to simulate it over here. So follow along. I have been enjoying the conversation. I think this is going to fit your needs well. So here we go. And then after I'm done with the demo, you can ask questions. All right. Does everyone see my screen? Good. Thumbs up. That's excellent. So this is the desktop version. This is exactly the same data that you would see on the phone. So how this is designed is that if I update the database, it automatically will update the desktop and the phone. So we can add links. We have an echo. You can add links here, and it'll dynamically show up on the app. So to simulate what you would see on the phone, this is what it would look like on the phone. All right, so how this works is my Santa Cruz County would have a phone app where you'd click on the report an issue. You would have view reports, report new issue, and issue status. You would click on the view reports, make a report you'd find, and it's a county-wide issue. So let's say we pick, since we don't have one, this is actual live data, you would click on the syringe image, and then you would be taken to a map. And then you would zoom in on your target, that where you found your syringe location. And this is something I teach people, is that if they dropped a finger on a map that's zoomed out, the accuracy is difficult to do. So I often remind people when they have issues with this to zoom in closer, and then you get a much more specific target. And then you say, okay, that address, and the way this address works is it picks the closest address to you from the street. And then you would set the target. So that's where I found it. You'd get a lat long information. You'd get an email from a reverse lookup. And then you could put in your name, information, type out, I found a syringe here. Then you could click on your photo, and I prepped for this, so I was walking in front of Costco and I saw something there, so there you go. There's my syringe I saw. Take a photo with my phone from my library, add it up, and then I would create an issue report. I'm not going to click this, it's actually live, so I'm not going to report this right here. Once that gets sent, you'll get an email confirming that you have submitted this. And on the back end, the code, what it does is it'll email the appropriate group to receive that information. So if you set it up so that, and this is what we do with DPW for like potholes, is that if the issue is dead birds or storm drainage, it goes to a specific group. If it's environmental health complaints, it goes to that group of people. We also have abandoned cars, dead animals, etc. So you can target who receives the information and who can access this information. So now for the public, though, so this is the public side, I have created a report and I want to view my status of my report or view reported issues. I might do this first before I make a report or not. But let's say I look up syringes, and yes, I know that says potholes, and what you can see is a density map of reports, and I can see all the submitted, the resolves, in progress, received reports, and I go, okay, well, the one that I was reporting in Santa Cruz is not been reported yet, so I get to do that. That's a good one. But this can also be information for you guys in terms of like locations, consistent locations for things. And that heat map, that density map can help you target where to send people to, or how to map the best path to be most efficient for your syringe pickups. So back home. Now, I'm going to bounce out of here, and I'm going to show you what the admin side of the world looks like. This is what DPW or syringe team that would go to pick up stuff would come in here, let's say if they had access to this. And since I am an admin, I get everything. I get to see all the information, but this list would be only what you want people to see. So based on the team that you're associated with, you may only see, I'm going to say potholes as syringes, you may only see just one thing on the list. It'll be syringes. And then on this list, you can see, okay, we've gotten these many submitted so far. Excellent. And I want to actually address this top one here. So I'm going to find out it was sent from a person, when it was sent, the description, the location, if there is anything specified, a photo. I can give a receipt. I can change its status, so the public will know that it's been received, it's in progress, resolved, or canceled. This is a field for DPW that they have their own. What I do is part of this system actually writes, I can push data to a third-party vendor. So let's say you have a third-party vendor that you're working with that does the data aggregation and assignment of crews. Then what I can do is I can take the data that I've collected, like the lat long location, time, date, all this, whatever is needed, and I can send it to that third-party app so that people can then use that tool instead, just as a FYI. And that's how you could interact with the back end with the data through this piece. So we have the front end, the public supplies the information. We have the back end where the admin can address the information, and the teams can handle that through this Santa Cruz County app. And you can see it was called Citizen Connect back in the day, and we've changed it to My Santa Cruz County, except I haven't changed the URL, so that's the naming conventions I kept, just because if it's not broken, I fix it. But I have named it here in the corner. And you can also see a map view of the data specific for just potholes, right? So all data, potholes. And the more data it is, the more or slower or faster it takes to upload pictures, the images. You also have a list view. That's what we're back to. You can export this data into an Excel sheet, so you can hand it off to whomever needs to do the analysis. Okay, so if I went fast, I apologize. I'm gonna bounce all the way back to top level here. And I am going to open it up for questions now. And since